Hello and a warm welcome to this video. My name is Dr. Sil. I'm a junior doctor from Australia, training to become a psychiatrist. And in today's video, we're talking about avoidant personality disorder. Going through my comments section is one of the things I really enjoy doing with a morning coffee. And this morning, I'm just realizing how many comments I've got about avoidant personality disorder. First thing to say is thank you for all your comments, guys. I read them, I appreciate them, and they do guide what I do next. It's very clear that people want me to do a video about this, so let's talk about avoidant personality disorder. It's important to start all these videos with definitions. And the definition that we use in psychiatry is often according to the DSM. We can also use the International Classification of Diseases definition, but for this video, let's just use the DSM. Just as a side note, the DSM, the Diagnostic and Statistical Manual of Mental Disorders, is an imperfect approach to classifying mental illness. It's the best we've got, but it's not perfect. And the reason that is that we are diagnosing mental illness based on observed behaviors and reported symptoms. So we can't do that with any other illness, right? Chest pain can mean, if someone's reporting I have chest pain, that doesn't tell you they're having a heart attack or a pulmonary embolism or a musculoskeletal condition or a pneumonia. You've got to do tests. And unfortunately, the brain is so complicated that we don't have good tests for avoidant personality disorder. We can't do a blood test for schizophrenia. We can't do a saliva test for bipolar disorder. So we don't have the perfect diagnostic strategies and systems in psychiatry, but we do the best we can, and so far it's the best we've got. But in the next 100 years, hopefully there will be biomarkers for different mental illnesses. That's a little disclaimer about the DSM, but they do provide very useful summaries of different behaviors and symptoms such that you can categorize illnesses, and it makes it easier for me to talk to another mental health professional if they say avoidant personality disorder. I kind of know what symptoms they're talking about, so it's very useful. So the key, theme in the symptoms of avoidant personality disorder is this issue in feeling socially inhibited, socially blocked. And it's a pervasive symptom that is the result of partially low self-esteem and partially concerns of what people are thinking about you that make you not want to open up, not want to connect because of the fear of negative evaluation of others, from others. This fear of negative evaluation from others can be so intense that it can be considered a hypersensitivity to other people's opinions. And people will avoid all sorts of things. They'll avoid relationships, they'll avoid meetings, they'll avoid social gatherings to the point where it causes distress and even possibly functional decline. I mean, people have lost jobs, lost relationships, become estranged from family members, all because of avoidant personality disorder. Now, the key thing with personality disorders is this word pervasive, okay? This is not, a period of 1 month of low self-esteem following a breakup where your ex was very nasty, saying mean things about you, and it kind of shook you to your core. That is, quite a disabling thing, but it's not avoidant personality disorder. Personality disorder, by definition, are pervasive. They kind of, you can see them evolving teen years, and by early adulthood, they've been established, and they last years. That's not to say they're not treatable, and some personality disorders do go into remission with treatment. So that's, there's a lot of hope in improving the symptoms and the burden of the illness. But yeah, these following symptoms do last long term. So let's go through the criteria so we get what the illness is. And essentially you need 4 of the 7 symptoms. That being said, if someone has 3, it doesn't mean that you don't do any of the treatment. If someone has 3 of these 7 symptoms and it's causing functional decline, you can still try these different psychotherapies to try treat it. And you might still get, functional improvement from doing the treatments for this. I mean, I'm strict in terms of what makes the definition of a diagnosis that you have to be in psychiatry, because it's, we need to be as objective as possible. But if you are having pervasive troubling symptoms, there's really not much harm in trying the treatment, like the psychotherapeutic treatment. Medications is a different story, but there's no significant harms in trying the psychotherapy for this illness or that illness if other things aren't working. So I try and stay pretty loose in terms of the psychotherapeutic approaches. At the end of the day, the most important indicator of whether psychotherapy works is your relationship with the therapist anyway. Getting back to this, sorry, I'm very tangential. The criteria. So 4 or more of the following 7. So number 1, avoids occupational activities that involve significant interpersonal contact because of fears of criticism, disapproval, or rejection. So this isn't just, avoiding going to a party because there's people there you don't know and you're a bit nervous. This is a very significant symptom where people will not take a promotion, they might start avoiding meetings, they could lose a job, they could stop going to work, all because of fear of being negatively evaluated by others. It's kind of like avoidance is the defense mechanism from feeling the pain of being rejected or negatively evaluated. Now, often people who have avoidant personality disorder, because of the shame of their disorder, they won't say, I can't make it because I'm feeling nervous or shy or worried that people will judge me. They might kind of say that they have an illness or have something else on or other tasks of equal priority. So they might try and cover it up because they might have some shame with this symptom. So the second symptom here is the unwillingness to get involved with people unless you are certain of being liked. So people with avoidant personality disorder can have very close relationships with their family members because they have a certainty that they'll be liked and they know that relationship really well. But they might not be able to make new relationships because of the fear and the symptoms of avoidant personality disorder. People with avoidant personality disorder often, in their intimate relationships with partners, they're often not that vulnerable, they're not that close and open. And that makes sense if you're really scared of the pain that you might feel if someone negatively evaluates you or says something negative about you or rejects you. So the defense mechanism might be to kind of push to keep people at arm's length because of the fear of what happens when you don't. When you let someone in, what happens? Heart is open, what's going to happen? It's going to get hurt because of your fears. That's the cognitive distortion that being open and vulnerable will result in pain. And so the relationship's often distant and that can cause problems. And, we'll talk about treatments in a second, and doing things like cognitive behavioral therapy will help address the cognitive distortions, the maladaptive thinking styles and beliefs, the core beliefs that aren't true about what happens when we open up. So number 4 is really a cognitive symptom. It's about what's someone thinking about, and it's preoccupation. People ruminating and thinking over and over about their fears of being criticized or rejected in social situations, and hence why they'll avoid social situations. But if they do have to go to an event for whatever reason, it's unbearable, it's painful. Okay, there's an ongoing anxiety, and this is a symptom that you do also see in social anxiety disorder. And so this is kind of where they overlap. But I do have a video of social anxiety disorder, and I can put a link to the video of social anxiety disorder in the description below. Now, the 5th symptom is about feeling inhibited around new people, new interpersonal situations, and that's really because of a feeling of inadequacy and shyness. Now, this can kind of look like stuttering or awkwardness, or even posturally. You can see someone who's uncomfortable in their posture. They might have arms crossed and shoulders scrunched up, and they can feel uptight and difficulty in just kind of relaxing, letting loose, and having a normal kind of calm conversation with a stranger. And the 7th and final symptom is really a reluctance, resistance to taking any kind of social or personal risk or to engage in any kind of social activities. So, if you have a person who's asking you out on a date, you want that, but you're saying no because of all the fears associated with dating and the possibility of rejection and being criticized, and if they find out who you are, they'll hate you, and all those kind of things. So even when the opportunity is there, you're resistant to it. Yeah, that is the symptom, the 7th symptom that we see in avoidant personality disorder. Now, we've spoken a bit about social anxiety disorder, but it's worth making the comment that difference between avoidant personality disorder and social anxiety disorder sometimes can be pretty difficult to disentangle. But avoidant personality disorder is more global. There are deep core beliefs in the person's self-esteem and ego being fundamentally flawed and not worthy and problematic. Whereas in social anxiety disorder, it's usually specifically just to social situations. The person might have a good sense of confidence in other things and might think that, might be able to have more relationships one-to-one, but it's in larger social settings that the anxiety symptoms can come up. With social anxiety disorder, there's often insight and awareness into the fact that the anxiety is not founded in reality, or I guess not, that it is a cognitive distortion and needs to be addressed. In avoidant personality disorder, the core beliefs are so core that it might just be seen as the absolute truth and not be seen as an inappropriate response or a maladaptive response. Now, it's important that before we talk about treatment, that you understand that you can't diagnose yourself based on a YouTube video and a lot of these symptoms can be seen in other disorders. So rejection sensitivity and behaviors of avoidance are not only seen in avoidant personality disorder. So you need to see a doctor or a therapist and get a diagnosis so that you get the right treatment. Now, if you do have a diagnosis of avoidant personality disorder, the treatment of choice is cognitive behavioral therapy. It is an important therapy in addressing kind of core beliefs and cognitive distortions. And what I mean by cognitive distortions is styles of thinking that are in a sense flawed in some way, but that issue is not seen by the person. So it needs to be explored. And also we'll talk about social skills training and that kind of stuff, which is really good. But in CBT and cognitive behavioral therapy, it's really about identifying the maladaptive thinking patterns, which means that, self-help books, fine, but they're probably not enough because there's an issue in your self-identification. So using a self-help book won't help you see the maladaptive thinking styles. You need someone else's perspective. And friends can be helpful, sure, but if this is a pervasive problem, if you don't have many friends because of the symptoms, then seeing a therapist is really useful. I know it's easier said than done. I know it's really, really hard, especially with avoidant personality disorder, to go and talk to a therapist. But just rest assured that therapists are trained in this. They are aware of how horribly painful that rejection sensitivity and fear of negative evaluation is. So just get to the door. That's always what I say. Just get to the door, ask for help, and give it a try. Because something probably needs to change, right? For what it's worth, I'm considering making my own online CBT course, which can help with, the avoidance and fear issues. So if you're interested in that, maybe I'll make a mailing list and put a link in the comments section, and then I can send you guys an email when the course is finalized. But that can be really helpful. Online CBT, online cognitive behavioral therapy, has almost as much evidence as in-person CBT. So it's a really well evidence-based style of therapy. And as a doctor training to become a psychiatrist, I need to do a lot of study of CBT and different therapies. So it'll be part of my training as well. So that's why I'm keen to do it. It'll be a win-win. So that's a little bit about CBT. The next kind of important is, I guess, more a behavioral therapy, but it's called social skills training. And it's just about learning how to be social. It's not inherent. It's not obvious. It's not natural for everyone to be social, especially if someone also has a comorbid autism diagnosis. So social skills are really important. Learning how to ask questions, learning how to listen, learning ways of bringing up information about yourself, and building resilience as well to awkward interactions, to negative interactions. I guess as someone who has a YouTube channel, I'm always going to get comments that are very negative at times. So that gives me an opportunity to practice my, negative evaluation, distress tolerance. So finding with your therapist strategies to build your own skills is very important. And for me, I try and use, what would you call it? I'd call it sublimation. I use the negative energy from one thing and I try and sublimate it into a healthier outlet. So exercise is a very good way that I use to manage the distress associated with difficult interactions. And this happens at work as well. Sometimes if I see a patient who has a psychosis and is doing dangerous things in the community, and I need to, as part of the treating team, we need to involuntarily treat them, they're not going to be happy about it. A big part of my job is copying verbal abuse. That's just the reality of it. So that can take its toll, but you got to find the defense mechanisms and your core beliefs and address them and use the healthy defense mechanisms. I don't want to call it trauma, but emotional, for lack of a better word. I don't think it's the right word for it, but I can't think of a better word. But you need to process all this stuff. Anyway, that's kind of it for this video. I do want to make the point that, people with avoidant personality disorder do feel an intense internal loneliness and a want to be loved and accepted, but the fear blocks it. The fear blocks it, and fear is treatable, right, through therapy. So do the work, good things will happen. Other than that, I wish you all a beautiful day, and I will see you in the next video. I'll put a link to the mailing list down below so that you guys can keep track of when the online CBT course gets released. I don't know how to do it yet. I'm going to have to learn how to make a website and things, but that's one of my upcoming projects that I'm keen to get done. Yeah, it'll be good to get a mailing list because then I'll know if there's interest in it. So please do consider leaving your emails below. All right, guys, I'll see you all in the next video. Bye for now.